Thank you very much. It certainly is a pleasure to speak in front of this august panel and almost larger than the audience, unfortunately. But as we were kind of talking, ethics is certainly one of the more important topics that we can consider, and I think it's critical that surgeons start paying attention to ethics because it's going to be one of the metrics that surgeons are measured on, among others, and for that reason I think it's worth our consideration. I was asked to talk a little bit about the responsibilities and ethical considerations. I'm going to try to, you have some great talks coming up, and I don't want to be redundant. I'm going to try to frame the philosophical question, if you will. My disclosures are that I've been involved in innovation for a long time, numerous companies and long thing. It's been one of the most pleasurable parts of my career, teaching and involved in innovation. But this is not without its cost. Innovation has two faces. It has its angelic side and it has its more devilish side, and I think that's really the context of this discussion is going to be both the highlights of innovation and the ethics around it and the ethical dilemmas that innovation in and of itself engenders. So there's a difference between creativity. I think most people are creative in some way or other. Innovation I like to think of as creativity put into motion, put into action. So it's one thing to be creative, to think of something, but to actually carry it through into a physical reality is a whole thing altogether. It really takes a certain type of person to be able to do that. Certainly it's driven surgery, and surgery is a list of innovations extending back to the dawn of surgery, where understanding of human anatomy required the great surgical anatomist to dig up corpses out of church backyards at their own peril, at their own risk, and explore how humans were made. Moving on to the 19th century, where the challenge was actually not killing people by operating on them. How do we do that? How do we transgress somebody's skin and actually have them survive? Into the 20th century, where he began understanding disease processes and addressing them both medically, surgically, and holistically. Not only how do we not kill the patient, but how do we make them better so that they're a productive person. And of course, the revolution in the 20th century that we were all involved in and are involved in, which is refining that curative process using technology. And I think more and more we're going to see an evolution of in innovation in making patients more productive and happier. So quality of life is going to be what innovation is going to be about in the second half of the 21st century. So the future is almost certainly going to involve medical devices, and a lot of innovation that we as surgeons are involved in is not so much now in understanding anatomy. That's pretty well worked out. Diseases are fairly well worked out, although genetics is certainly bringing new awareness to that. But surgeons love tools, and really innovation to us largely boils down to new devices, new technologies, new approaches, new tools that we can use to deliver better care. And this doesn't stop. This is not stopped with laparoscopic ports or ultrasonic dissectors. This continues on today, and now we see computers being introduced, robots, genetic manipulation, and all sorts of new things. So this process is inevitable, irresistible, and irrefutable, and will continue as long as we can. I have to give a shout out to SAGES as being a home to innovation, and really a place that has made people who innovate comfortable. I think if you belong to some other societies, some of us belong to, just pulling a name out of the hat, the American Surgical Association. This is not an innovation-friendly group. It's not where you take your innovations. On the other hand, SAGES is, and it's been a home for all of the innovators out there, and for all of those who really try to push the boundaries and frontiers of medicine. So there's two different forms of innovation, and I take this from a great talk the ex-president Dave Ratner gave several years ago at SAGES, which I thought was very eye-opening to a lot of us. And he talked about the two different types of innovation: incremental innovation and disruptive innovation. And I think the very word disruptive kind of captures the ethical dilemma that you can come to when you talk about this. And just to remind people what this was all about, This is kind of an up-to-date adaptation of an algorithm that he showed to kind of explain this concept, where he looks at the value over time of innovations, value to our patients over time. And so gradually, even a good procedure like an open Heller myotomy gradually loses value to patients because there's less invasive alternatives or more patient-friendly or less painful alternatives. And what happens then is it becomes irrelevant. It becomes maybe not the cheapest thing, but nobody wants it because it's not the least invasive. And then you'll have a new innovation that comes in and disrupts that. It fades away. It becomes extinct like the dinosaurs. In that case, it was laparoscopic Heller myotomy. Nobody really does open Heller myotomies anymore. And now today, you've seen every day of this meeting discussions of POEM, endoscopic Heller myotomy, and I predict that's going to be the disruptive thing to laparoscopic Heller myotomy and gradually replace it because it's more patient-friendly, it's less invasive, it's less painful, and patients go back to their work or their family in 3 days. Disruptive innovation. It's the way things are, and it's a good thing. It pushes things ahead. On the other hand, there's a danger to surgery in this, in that incremental innovation might not be fast enough to keep up with the times. It's pretty acceptable. It's pretty easy. We're all comfortable with incremental. Disruptive innovation is disruptive. It's a little bit hard to stomach sometimes when somebody comes in and says, I have a better way than what you've been doing for most of your career. You can either learn it or not learn it. But the problem is that can push us outside of traditional practice and make what we do today obsolete. And then you're faced with the choice of either becoming obsolete or re-educating yourself and reschooling yourself and then saying, this is better, I'm going to do it a different way. I think a good example is in my field of foregut surgery. I've seen a migration over the last 25 years of progressive procedures that I once did commonly every week, now having gone to endoscopy. And these are innovations that have largely disrupted surgery, and surgery is now no longer commonly performed for the majority of these diseases. They're now endoscopic procedures. As a surgeon, I was faced with the choice of sticking to my guns and being a surgeon, doing what I was taught, and not doing these cases anymore, or learning endoscopy and starting to do it this better way. And I think we're all faced with that choice. To shift focus a little bit, there's a lot of forces against innovation. There's a lot of forces against adoption of the new, and I'm not going to go into this in detail. It's just to say, I put this up there just to say that the innovator and innovative ideas are difficult to bring to birth. And it takes a lot of work and a lot of time, and nature is against the new in some ways. It's costly. Your patients have to go through a learning curve. Our administrative structures are inherently against this kind of disruptive process because they have to rekey and regear. So this is not an easy type of thing. And that brings me kind of to discussing the personal aspect of this. So we talked a little bit about innovation in itself, but how about the innovator? How about the surgeon who is driven to innovate? And it's an interesting sociological phenomenon that there's some humans that are simply driven to do things in a different way. This is from a sociologic textbook that I read. It's estimated that 1% to 4% of people have personality traits of innovation and almost pathologic questioning of the established way, a need, an almost physical need to change things, to make them better, and to some extent a willingness to disregard others during the implementation of the new. And it's that last sentence that gives rise to the ethical dilemma that the innovative surgeon faces on a day-to-day basis, both in a personal way and in a patient care way. It's certainly true that innovators tread the razor's edge when it comes to ethics. How do you tell a patient that they're going to be the first one to have something new done to them and convince them, sell them on that idea, really tears a surgeon's heart in half, because you really want to do what's best for them. You know in your heart you don't know how this is going to turn out, and yet you have to do it. You're driven to do that. So this is difficult. It's difficult both from that personalized standpoint, and it's difficult because, to be perfectly honest, the system doesn't like innovators and inherently rejects them. By and large, if you look at the establishment's definition of a surgical innovator, and this isn't about surgeons indefinitely, you'll find things like this. Research suggests that true innovators are more likely to be social deviants, abnormal in epistemic drive, and adopt innovations indiscriminately rather than based on any rational choice calculus. Why should we understand and evaluate their behavior? This is the structure of society is kind of based to perpetuate the sameness, and you have these 4% of innovators out there driving things. This reminds me of my talks with Blue Cross Blue Shield whenever I go discuss something new. And I think we in the laparoscopic surgery field certainly have somebody that was a living proof of this. I'm sure all of you know the story of Eric Neway, the first person to do laparoscopic cholecystectomy, slightly different way. He blazed that pathway. He was a really innovative guy, an inventor. One of these individuals is truly driven to innovate almost as a physical need. And this destroyed him. This destroyed his career. He was driven out of the German Surgical Society. He was castigated. He was sued. His wife left him. He was bankrupt. And eventually, he essentially died of a broken heart at a relatively young age. It's tough being that trailblazer. So how about the patient? I think it's always about the patient for all of us. And how about from the patient standpoint? How about innovation? How about the innovative surgeon? I love this statement: there are some patients whom we cannot help, and there are no patients whom we cannot harm. So we always have to be careful about how we approach our patients. And that makes surgery an especially difficult field for innovation. I'd say one of the hardest. If you're a software engineer, yeah, innovate all you want. I mean, who cares? But for a surgeon who has a life in their hands, who has a duty, an obligation, a responsibility in their hands to care for a patient, it's a tremendous burden. And as I say, it often leads to this kind of rending of the heart for surgeons to make that decision of you know, in my heart I want to innovate, in my heart I want to take the best care of patients. Along with that, society is not supporting that much either, which is good for patients in a way. It's becoming unacceptable, if not impossible, to subject patients to a learning curve. We all know that. Our residents suffer from that. Residents are no longer allowed to essentially operate on patients. We're all going to pay the price for that down the road. But this is an attitude that's bad for innovation. It's bad for training, bad for the future of surgery. And I really think it's the duty of societies like SAGES to go to battle against this kind of attitude. There is a middle path. There is an ethical middle path that allows us to innovate for the good of patients. And I'll talk about that. I think it'd be a tragedy if we shut down innovation, whether it's administratively or by not supporting the innovators out there. That so few now dare to be eccentric marks the chief danger of our time, and that's very true for surgery today. And equally, this from Alexis de Tocqueville: I cannot help fearing that men may reach a point where they look on every new theory as a danger, every innovation as toilsome trouble, every social advance as a next step towards revolution, and that they may absolutely refuse to move at all. So I think if we shut down innovation, we're going to shut down progress, and that's not going to be good for anybody. On the other hand, you have to be ethical, because the dark side of this, I mentioned that's the angelic side. This pushes surgery ahead. This gives better care in the end. The dark side of this is really emblematic in this painting by Akins on the Gross Clinic. Famous painting, well-respected painting, but it bears close looking at, because this is the innovator we don't want to see, I think. And why do I say that? Well, you see this imperious figure, yes, from the last century, standing there operating on somebody, but look in the background, and that's the patient's mother in the operating room, cringing in horror at this guy brandishing and discussing the case with the audience. And I think this is not ethical behavior. This is really transgressive, and this is what we have to guard against if you're an innovator yourself, or to protect those people in your group or an acquaintance that are innovators. You don't want to stray into this self-glorification mode. So responsibility was part of the title. I was assigned to talk about what is responsibility for the innovator. obviously, society has imposed some regulations, and I think innovators have to abide by these. These are the laws of the land, and they were created for the protection of humans. And you have to go through the IRB, you have to go through your credentialing committees, and they are there to protect patients. And while the innovator may bridle against this and not want to do these things, they're there for a purpose, and I think they have to be honored. I think that mix, that duality of the surgical innovator's soul, being the misfit, being the kind of antisocial person, or being the hero that pushes science ahead, is really there. That needs to be celebrated, that needs to be protected and facilitated, and it needs to be guarded against in some ways. So what are the ethics of the innovator? What do they need to be? What do we really need to look for? This is really in the individual's heart and can only be defined in that way. And I think it boils down to two things. Is this innovation done for the good of the patient, or is it done for personal glory? And I think it's quite obvious which one's ethical and which one's not ethical. So that's, in conclusion, I'd just like to say that innovation is the lifeblood of surgery, and organizations like SAGES need to fight to defend it, because there's a lot of forces arrayed against it. That surgeons need to participate and assume control of disruptive innovation, or they stand to become obsolete and their practices outmoded. I think we need to watch out for our surgical innovators in our midst. They're really pretty lonely figures, 4% of the population. They need support, encouragement, but they also need boundaries established for them to keep them from becoming unethical. And as a surgical society, we need to focus on a new model of innovation, I think, that keeps up with the times. I think old ways of thinking about it won't fit anymore with current activities. And we need to start teaching innovation in a responsible way. Thank you.